Ajita.
Yeah. Yes. Now the recording started. Thank you so much, Captain Madhukari, for your brief introduction. And I would request Captain Ajita, the President of Association of Nursing Executive of India, to speak few words, encouraging words for the entire, panelists and the participants, those who have joined today. Ajita, over to you before starting.
Very good afternoon to all of you. Thank you, Dolly and Madhukari, for organizing this, and special thanks to Madam Kavaljit Oberoi for coordinating this Empower Hour for the entire year. She will be leading this our mission in this year. So Empower Hour had been our trademark program for last 3 years, and we have entered into another year of Empower Hour. So as it says, it literally empowers the staff on ground. That is our idea of having this Empower Hour. It is a monthly program. And last year we had, each year we have a theme. Last year we had, patients in each of those 12 discussions, because we wanted to bring the patient in the forefront of all our activities and, empower them as well. And collaborating with the patient was last year's theme. Now, this year's theme is, we have introduced something known as ANEI Young Nurses Alliance. So, whereby we want to have the young nurses, the young staff nurses, as well as the student nurses who are waiting to become staff, talking to us, rather your dream, your expectations, and what is that you can contribute to the profession. So in this series, we have today, I'm really happy that we are having a panel discussion on transition to practice voice from young nurses, and we have 2 staff nurses and 2 student nurses. I'm very happy their names have been taken, so I'm not really taking their name. Maunami, Bishal are staff nurses, and Sujismita and Aditi Ghosh are the students. So we are really lucky to have. Thank you for volunteering to be here to talk to us. And I would request the 2 staff nurses to become ANEI members, and also the rest of the people who are. As Madhukari said, Association of Nurse Executives India had literally become the voice of nurses in the country. And I'm really humbled to be heading this organization. I'll be heading it till December of this year, and then my tenure will be over. So without much ado, I am happy that many people are still joining, and this program will be recorded and will be uploaded in our YouTube channel. And wish you all the best, and looking forward to a very fruitful discussion from 4 of you, which is going to be efficiently moderated by Ms. Lodi Biswas. Thank you. Over to you all.
Thank you very much, Ajita, for your such a wonderful words. It's truly encouraging, and the way the entire India is almost nursing fraternities are taking membership. It's amazing to see the way you are working. It's really very nice to see every day new members are joining to ANEI. Now, I would like to request Kavaljit ma'am, who has actually coordinating the entire ANEI Empower Hours program, AYNA, which is the first episode started today. So Kavaljit ma'am, over to you. Please share a few encouraging words to our entire panelists and the participants. Kavaljit ma'am? Yes, thank you, ma'am. Thank you. We can't hear you, ma'am. I think you need to, increase the bit of volume. No, sorry.
Now, can you hear me?
Yeah, we can hear you now.
You can hear me? Yeah, okay. So, good afternoon once again, all of you. And thank you, Ajita, for setting up the tone, and Dolly to moderate, Madhukari to coordinate with this exciting team of young nurses. And we all are waiting to hear. I'm sure a lot of nurses are joining and have joined for this Empower Hour. This is something which is really very exciting. And the topic itself, transition into from practice to, this transition, I have to see this topic, transition to practice, voice from young nurses, is really going to be very, very exciting. We want to hear from our young nurses what they expect, what they would like to bring it to their team, and how the entire country would be hearing their voice. So wish you all the best, young girls, guys and girls, and Madhukari and Dolly, to make it more exciting and sharing all your experiences across the years you have put into nursing practice. Thank you.
Thank you so much, ma'am. Thank you very much.
Thank
And
you.
I can see my friend from Singapore, Miss Ruma Bhattacharya, she has joined. I'm glad to see Ruma over
Wow.
here. So thank you so much, Ruma, for joining today. So let
Thank
me
you.
take
Thank you so much, Dolly, for sharing your this one ID, Zoom ID.
Thank
Thank
you.
you
Thank
so
you,
much.
Ruma. And Captain Sandhya also will be joining shortly. So thank you. So without taking much time, now let me start the panel discussion. And once again, to all the panelists, Monami, Vishal, Suchishmita, and Aditi, most welcome to this ANEI Empower Hour session. And glad to see that all of you are here today and you have accepted our invitations for this panel discussion. So without taking much time, let me take you through the entire discussion. So I'm just stopping the sharing of the photographs as you all have seen them, and now we'll be seeing them physically how they are talking. So, well, as we know that in India, almost we are having more than 10,000 of the nursing school and colleges, and almost 2.5 millions of nursing students are coming out from the college after passing successfully. And so it's very important when we have chosen the topic, transitions to practice, voice from young nurses, we really need to understand that what their feelings, what they are understanding, and what they aspire to become a future leader in nursing and to lead the entire country and the whole world. So I would like to welcome once again to all the panel members, and there will be 3 rounds. I'll be taking first the students of final year BSc nurses first, and once they complete their all 3 rounds, then I'll be taking the staff young nurses, those who are actually in the clinical practice, to go ahead with the discussion and the leading questions. So first leading questions which I would like to call Ms. Suchishmita. Suchishmita, your video and the audio both are on now. Thank you, Suchishmita, for joining. So to you,
Dolly, mention the time also, how much they can take per session.
Yes.
That's our question. Yeah.
So each questions which will be taking just 5 minutes to speak, and so that we can complete it within the time limitations, whatever is there in our hand. Because today we are having another talk from 2 p.m. I think 1:30 p.m. IV talk. So I think people will be eagerly waiting for join that talk as well. So from INS. So let me take you through the first question. So, Suchishmita, since you are the final year student, so what have you expected differently in College of Nursing to groom you as a nurse? I know that you are getting sessions, you are your collegiate program, your teachers, everything. But do you have any expectation differently from your college?
Yes, ma'am. Thank you so much, ma'am. Ma'am, am I audible?
Yeah, sure.
Good afternoon, everyone. I'm Suchishmita.
Right. Yeah. Voice is breaking.
Finally, just a destination from the simulation-based practice, which is the most needed thing to make the transition in the nursing.
Your voice is breaking, Suchishmita.
I think ILF will be more beneficial for.
You are muted.
Ma'am, am I audible now?
Yeah.
Okay, ma'am. Ma'am, I think more hands-on practice in the skill lab will be more beneficial for the student nurses because they will be able to bridge the gap between the theoretical and practical knowledge and the critical thinking skill, the problem-solving skill, the clinical judgment power will be improved. Now let's move on to the preceptorship. I think the nursing colleges and all the nursing institutions should be give their focus on the preceptorship facilitated sessions because the preceptors will help the student nurses to guide themselves in the clinical area. They can detect their shortcomings easily. They can take the remedial actions accordingly. I would like to talk about the mentorship also. The colleges should focus on the mentor and student ratio because if one or two mentor has or have to handle a large number of students at a time, then it will be very difficult for him or her to guide all the students correctly. Now, I would like to focus on the mental health and wellness of the student nurses because it is a very crucial part in the life of the nursing students. The colleges can arrange more stress management sessions. They can arrange the self-awareness program, how to prevent the burnout, etc. Then it will be more beneficial for the students. They can uplift their standards. I also think that adequate library and more online resources in the colleges are necessary because access to the comprehensive nursing literature, databases, evidence-based practices, and online resources can support the student nurses for academic success and research. Let's focus on the expanded roles of nurses. According to me, not only as a staff nurse within the four walls of a hospital, we can work in various settings also. We can work as a clinical nurse practitioner, as a clinical nurse specialist, occupational health nurse in the community, as a nurse researcher, nurse navigator, and also a tele-nurse also. So the institutions, all the nursing institutions should make the student nurses oriented about all these things, about the expanded roles of the nurses from very beginning, so that the students can prepare themselves accordingly. Now let's discuss about the NCLEX preparation and the job readiness. The college curriculum can focus on the NCLEX examination preparation and job readiness. Structured review courses on progress to prepare the students for the NCLEX RN examination and practical training on resume writing, interviewing, and job search strategies are needed to ensure a smooth transition to their workforce. Opportunities for interprofessional collaboration, more standardized communication can foster a teamwork, which will also be beneficial for the student nurses. And last but not the least, the development of emotional intelligence, self-awareness, resilience and adaptability, critical thinking and problem-solving skills among the student nurses is very crucial. The nursing curriculum needs to be more specific about all these things because these qualities of a student nurse will help him or her to be more competent nurse in their future. Madam, according to me, these are all the things which can be adapted differently in College of Nursing to groom us as a nurse, as a competent nurse. Thank you, madam.
Thank you, Sucheshmita. Excellent. Very well spoken. All the aspects, you spoke about the different paradigm of nursing, and you spoke about the various role that the nurse, when comes out after collegiate educations, will play. And so the orientation to every aspects, which is very, very important to groom the nursing fraternity or the nursing students, are very important. That what collegiate pedagogies they need to take. The simulation, you spoke about the simulation lab, you spoke about the good practices and the mentorship, you spoke about even preparing the students to serve to the abroad, the NCLEX examinations, how we can guide that the college education can guide, the teachers can guide. So that also you have spoken about it. The emotional stability, for the emotional stability, how teachers can take part for the students you have spoke about, so that the burnout should not be happening. And so fabulous, you have spoke almost many aspects you have touched. Thank you very much. So we will move to the second speaker in the first round, Miss Aditi. Aditi, as a novice, Aditi, can I see you? Yeah, you can unmute yourself. Thank you for joining. So Aditi, as a novice nurse, what type of job you design in your mind?
Thank you, ma'am. Am
Thank
I
you.
audible, ma'am?
Yeah, audible.
So, good afternoon to all the respected delegates present here. Myself, Aditi Ghosh, final year BSc Nursing student of Sister Florence College of Nursing. First up, I would like to thank you all for giving me the opportunity to share my views. So, as you asked me, the novice nurses, my job, that I design in my mind. So, novice means a person who is new to or inexperienced in a job. So, as a new learner, so a student nurse who get exposed in many words but gathered a few knowledge regarding when they get exposed to in any word. So, as a new learner, I would prefer a job that is combined with my passion for the patient care and which help me to grow through learning. I want to work in a unit where I get the critical patient as well as the normal patient so I can improve my critical thinking and the problem solving skills and communication skills. I should get the opportunities to perform many tasks and proper guidance to be provided from the co-worker and the mentor who are present there and all the superiors who should be helpful to me. And when we get exposed as a student, when you get exposed to any word, we get many issues and many challenges, many pressure. But when we, as a nurse, when you get as a novice nurse, when you get job, the proper guidance and mentorship should be provided, and the delegation of work should be provided according to my capabilities. Thank you, ma'am. So, as a novice nurse, I prefer this type of job I should get after when I get the registration from this job.
Great. So you mean that as you come out as a novice nurse and you are ready to serve, so you called as an advanced beginner state, and there you need to have exposure to the stable and a critical patient as well. So you need to learn about criticality, you need to learn how to communicate with the patients and the fraternity or the entire team when you will be working with you. So how to communicate, how to connect with patient relatives and clinicians and the other people, those who are working with us. So great. So that is the way how you need to have your understanding about the job design. So thank you, Aditi. Now the next round of questions again to Ms. Shuchishmita. So what type of teaching methodologies you would like to adopt for nursing educations? You have to talk about the teaching methodology. In the first question, you spoke about few. So now, just to highlight the methodologies of teaching. So I would like to listen.
Ma'am, I think the future of the nursing education is not just about teaching, it's about transforming. For nursing education, I would like to adopt a multifaceted learning and teaching methodology that incorporates various approaches to cater to different learning styles and needs. Let's focus on the interactive learning process. There are many students who can be benefited from the interactive classes like group discussion, brainstorming, demonstration, and so on. Because in the traditional monotonous lecture sessions, the students mainly participate as a passive learner. But if more interactive learning sessions can be arranged, then they can participate actively and the problem solving, critical thinking, clinical judgment, and decision-making skills can be improved. Moreover, the knowledge will be internalized among ourselves rather than just making good scores in the examination. Moreover, the interactive lectures with technology can be incorporated also. It can use the multimedia tools like videos, games, online quizzes, and flipped classroom also. In the flipped classroom, the students can review the content before the class and engage in discussions during the class. I think the problem-based learning will encourage critical thinking by presenting real-life patient scenarios for students to analyze and solve it, and it will help to bridge the theoretical knowledge with clinical practice. So problem-based learning is also important. The case-based learning will provide in-depth analysis of patient cases to the students, and they can apply the knowledge to different conditions. More simulation-based learning can be adopted by using high-fidelity mannequins and virtual simulations. A real-world situation can be created. and it will build confidence and clinical decision-making skills among the students in a controlled environment. Lastly, the integration of evidence-based practice can be adopted. It will teach students how to apply the latest research in their nursing care and develop a critical appraisal skills for lifelong learning. Ma'am, I would like to adopt all this kind of teaching methodology in the nursing education. Thank you, ma'am.
Very good. Very well, you have narrated everything. Very good, you have spoken. So we can understand, see, in India is a diverse country. We have many school, many nursing colleges, but you know, syllabus are same. That has been developed by Indian Nursing Council. But when we come to the teaching methodologies, talking about the high fidelity mannequin, interactive session, brainstorming session, how the student nurse to be encouraged to take the decisions, case-based learning, clinical correlated learning, all these are very important, where our the lecturer, the professor, or the teachers of the college, they must understand, and they take care of the students with such kind of learning which you have spoken today. And without this, if the students are 100 sitting in the classroom and only one way of teaching methodology, none of the student wants. Today, vision is different completely, and the methodology is also what is to be adopted. These all are the types of learning where the students will be learning in a professional way, as well as lot of brainstorming can take place. So thank you very much for describing such a fantastic way of adopting the learning that every student must get. Now, in the second round of questions, I would like to request Aditi to unmute your mic. So how will you contribute to the society to attract brilliant students to join for the nursing? Because,
Yes, ma'am. So, nurses makes a significant contribution to the society, not by providing the essential medical care, but they also provide the emotional medical care to the patients. So, how I will contribute to the society to attract the brilliant students to join the nursing education? So, firstly, through providing the community events, where I can provide the free health checkup, health education regarding any disease and the disease prevention and the pre-morbidity. I can showcase the nursing impact on the public health. Secondly, by arranging the school health program, so where I can act as a career guidance or the mentor, introducing the students about the nursing services and the career opportunities which are related to the nursing, and the scholarships and the rewards which are actually related to this nursing field. And there are many scopes which are actually related to the nursing. So if the student not only want to become the staff nurse, there are very aspects. They can be a clinical instructor, they can be a forensic nurse, they can introduce themselves in various aspects. So I can introduce them about this through the school health program. Thirdly, I can use the social media platform to provide information regarding the nursing and regarding the nursing career opportunities. So lastly, I should be devoted and well dedicated to the nursing profession, so that my work and my devotion can attract the students to become motivation to this profession.
Thank you. Great. Very nice. So you said that we need to, sell ourselves. We said that jo dikta hai, wo bikta hai. Isn't it? That is the simple terminology. So we need to sell ourselves. We need to focus in the media, in social media, in the society, in the community. People should know what a nurse can do. Many people have seen when we are facing first, second, and third wave of COVID-19, that how nurses contributed. And now you see, there is no dearth of the institute, and similarly, there is no dearth of the students to fill the seats. And already people are motivated to join nursing. But as you have spoken, that lots of program, lots of advertisement, pre-health checkup, health education, school health program, various job opportunities. There are different kinds of, that opportunities that the students can get in her life, throughout her life, not only be a clinical nurse, but research nurse. There are various aspects of our jobs that are there so that they can adopt and they can join for nursing. So that's the way how we need to motivate our nursing students and the class 11 and 10 and 12 students to have all those kinds of knowledges, and so that they get more motivated and join for the nursing for the safety of our patients. So thank you, Aditi. That's great. So now questions goes to Suchismita again. Suchismita, what is your thought on patient safety in the healthcare organizations? Because we all are for patients. If patients are not there, we will not be required. So it's very important to, from your mindset, right from the first year when you have joined, from that time onwards, we need to inculcate in the mind of the student the safety of patient. So what is your thought on it?
Yes, ma'am. But patient safety is not just a goal, it's a moral obligation. I think the nursing curriculum needs to incorporate the patient safety as a separate disciplinary approach to uplift the safety measures of the patients, all the standards of guidelines and protocols for healthcare professionals. And the organization should follow the tools like the International Patient Safety Goals or IPSG, developed by the Joint Commission International JCI, which focuses on reducing risk and improving patient safety globally. The International Patient Safety Goals help to identify the patients correctly, improve effective communication and safety of high alert medications, ensure safe surgery, reduces the risk of the healthcare associated infections and harm of the patients from fall. Moreover, if the healthcare organizations can maintain the standards of practice and the international patient safety goals, they will get more accreditations and the overall patient safety will be improved also. My next high alarming point is about incident reports. From first year, I have been seeing that the most common incident which is made by the student nurses is needle stick injury. The newcomers don't even realize how fatal it can be if they don't take immediate actions. Even they don't report it out of fear. So I think discussing about all the common incidents with their root cause analysis and the corrective and preventive actions is very important. We can tell them like a story as per the level of the student, because if they already know what is the root cause analysis, what are the corrective and preventive actions, they will feel empowered in their clinical postings and the number of the incidents will be minimized also. Let's discuss about the evidence. Yes, ma'am?
Yeah, please go ahead.
Let's discuss about the evidence-based practice in nursing field. I can remember once I was posted in the surgical ICU unit and the patient came from outside with the 2-degree pressure ulcer. The normal traditional gauze dressing was applied, but the healing process was very slow. And after a few investigations, a senior in charge told us about the hydrocolloid dressing. So I think, and it worked amazingly. Mentoring programs and dedicated time should be provided to the young nurses as well as the student nurses for evidence-based practice in nursing field to improve the patient safety. So evidence-based
there is a connectivity issue, Suchishmita. I think you have covered almost all the points in terms of patient safety. And you have rightly spoken about the International Patient Safety Goal. So, from ANEI, the various states who is taking an efforts for a week-long program on patient safety goal, which is reaching to every students and staff, those who are connecting, and many states are doing. And also we have next agenda of of conducting this patient safety goal next webinar. So it's very, very important. Yes, students also should get some of the orientation on these standards that is to be followed from NABH that's been laid down, JCI standards in terms of patient safety, and of course, orientation on international patient safety goal, as well as the evidence-based practice. You have given a very beautiful example of receiving a patient with CAPU, that is community-acquired pressure ulcer, having a gauge dressing, and you have learned that how an hydrocolloid dressing, which is helping to heal the wound well. So thank you very much. So that is the in terms of patient safety, the adoption of all those good practices which you have spoken today. Now, questions for Aditi. Aditi, for you, you just unmute your mic. Yeah. Do you think as a student nurse, actual clinical practice with patient care significantly different than a classroom teaching? And if so, how you do biculturalism, or how you think that you will be able to adopt the actual clinical practice? What is the difference that you are finding? Because you all go to the clinical every day while having a classroom teaching as well. So what is your thought on it?
Yes, ma'am.
Yes, yes, you can speak.
Yes, ma'am. So the stressor and the challenges that are encountered in the clinical settings that are muchly differ and significantly differ from the classroom practices. So classroom teaching mainly provides us the theoretical knowledge of the foundation of nursing, concepts, their principles, and example related to it. But in real life world, which is much deeper than that, clinical practice can help us to build our competency level, and classroom practice mainly refers to the learning in the traditional classroom settings, usually involving the lecture, discussion, simulation-based practice. But sometimes students get distracted or get bored to the classroom practices. But when they get to know about the hand-on practices, when they actually get exposed in the world, the real application of knowledge they can apply. So they get to know about the real meaning of the evidence-based practice, value-based practice, needs-based practice. So as for example, as for me, I can say that we all gather to know about knowledge regarding the triage system in the emergency in the classroom. But when I actually get exposed in the emergency ward, I get not only get to know about the triage system, but also get to know about the management skills, environmental preparation, multidisciplinary team approaches, and their significance in the emergency, and how to be calm and focused at the time when we should panic at the time. So through this, the clinical practice can help more than the classroom practices. I am not saying that classroom practices is not needed. Classroom practices provide us theory, and the theory that we apply in our clinical practices. Theory helps us to get knowledge, where practice makes it perfect, where I can relate the actual theory to the practices. Thank you, ma'am.
Very good. The last line which you have spoken, that relating the theory into practice is very important, and learning evidence-based practice, real situations, understanding the real patient, using a high fidelity mannequin in our demo lab, learning on the mannequin, whether it is a high fidelity or simple mannequin, still the real life practice is much important. And there during right from the first year of students, the student should get the exposure with the help of the clinical instructor, where clinical instructor thinks that should feel that the patients, when being allocated to the students, it's their patients, and they need to be every moment be with the students so that patients get a safer care. And that's very important, hand holding and making them the understand, or connecting between theory and practice is what the teachers does. So now I almost completed with all the three rounds with two questions, three questions to each. So before starting with our another two panelists, from panelists Miss Monami and Bishal, I would like to just draw attention from Captain Madhukari. Captain Madhukari, just unmute your mic and just give your thought that, nowadays students feel that once they pass out BSc nursing and soon they jump into the masters. soon they jump and they don't want to go for a clinical exposure. And do you think that which one is better, whether jumping into the MSc nursing or getting some exposure and then go ahead with the masters? What is your thought on it? It's from Captain Madhukari. Can you please unmute? Okay, so I think she might be busy with a bit of, or so who will take this question? Ajita? They are busy. If anyone would like to.
Okay, just a second.
Yeah. Ajita, I think you heard me.
Yes, I heard half of the question.
Yes.
So is it? So I am just rephrasing it. Correct me if I'm wrong. That
Yeah.
whether should somebody go for MSc nursing immediately or after some clinical experience?
Yeah. What is your thought in? Because it's very difficult to set the mind, because we are recruiting nurses and novice nurses, fresher, giving opportunity to work, and even 4 months, 5 months, then they come with the resignation. Ma'am, I got an MSc. I want to leave. So do you think when I insist them, no, please better and try to understand, get an 1 year experience or 2 year and then jump for master? What is your thought on it, Ajita?
So Dolly, if I tell my experience, I had gone for masters after completing 4 years of clinical experience in armed forces.
Absolutely.
So those days it was compulsory to have 2 years of experience before, it was a mandatory requirement for going for
Yes.
MSc. And in between, the INC had taken away that condition.
Okay.
So I do explain the same thing to anybody who jump into, say, MBA after a graduation. Unless and until you understand certain things, you have the maturity and exposure to understand certain things which are taught in the master's level, be it in nursing, be it in management, be it in anything. You will not get the complete benefit of the money and time spent over there.
Absolutely.
You may be, going through so many activities, going through so many literature, and you may write exam and pass. But what happens after that?
Yes.
When you come back to the clinicals, all of us know that how are the nurses with MSc qualification when they get back to us in the clinical area. They may be able to recite the same thing to the students and maybe to teachers if they are good in their verbal ability. Yeah. But the connect with the real situations which a teacher should be adept at, they are not. Why? Because they themselves lack the exposure and experience of handling patients at the bedside.
Absolutely.
So if an MSc nurse has to be a good clinical nurse, then only this masters add value to being called as masters. Same thing with PhD, I feel. So the biggest drawback in our system, in our Indian nursing, is that we have, multiple the number of masters and PhDs, but a master of maternity nursing, does she know to conduct a delivery herself? Or is she able to contribute to patient care in a situation where a high-risk pregnancy is handled?
True.
So when we think of practical, say another example, somebody masters in critical care nursing, are they able to work as an in charge of a critical care ward?
Absolutely.
Absolutely not, is my experience of being 18 years as nursing head in corporate hospitals.
Very right.
Unless and until this situation changes, where a master's literally means that they are master in their specialty, in giving care to the patient, not just claiming their, position. Then only the nursing standard will improve in our country. So this is what exactly happens in Western countries, where nursing has reached a status where somebody says a master, they are literally master in their area.
So actually,
like a doctor. Same like a doctor.
Ajita, you are very right. That is the transformation we are looking for, and we are telling our young nurses, young buddies, that they should have that transformation in place. That, when they are put in the situation to actually swim, the certificate is not going to actually add value to it. It is the experience which matters. So experience will definitely take us forward to combat the situation and to handle it effectively. So thank you, Rita, for your inputs. I think, Dolly, we can allow the
we can just thank you, Ajita, Captain Madhukari. Thank you for the inputs. There are many nursing leaders. I can see Paruldi, I can see Arpita. Many nursing leaders have
We
joined
don't have
today.
much time, so we should allow the speakers to speak now.
Yeah, now
Yeah.
now we will take through the staff, Miss Monami. Monami, you can just unmute your mic. Yeah.
Yes.
So Monami, most welcome to the session and this ANEI Empower Hour. So I would like to share the question is with you. When you have entered into the actual clinical practice after completion of your nursing course, what was your feeling? What did you feel? Yeah.
Thank you, ma'am, for the question. Good morning to one and all. My name is Monami Dawn, and I'm currently working as a staff nurse at CKBH CMRI Kolkata. I thank all the esteemed nursing leaders present here, Thankam ma'am, Kawaljit ma'am, Captain Ajita ma'am, Captain Madhukari ma'am, Dolly ma'am, and Vijayalakshmi ma'am, and to all the leaders for creating this opportunity for us to share our views on such a great platform. It is an honor to be before you, ma'am, and share my experience of stepping into the world of clinical practice for the very first time. Stepping into actual clinical practice for the first time was a profound and transformative experience. As a nursing student, I had spent years absorbing theoretical knowledge, practicing in controlled environments, and preparing for the day I would stand at a patient bedside with real responsibility. But the moment I actually entered into the clinical field, I felt a mix of emotions, excitement, nervousness, and an overwhelming sense of duty. The hospital environment is fast paced, demanding, and required me to apply everything I had learned, but in real time with real consequences. I quickly realized that beyond technical skills, nursing was about adaptability, teamwork, and making decisions under pressure. There was no pause button. Every action had an impact on patient care. However, what truly helped me to find my footing was the structured system in place, the protocols, the guidelines, and the strong leadership that ensured standardization and quality in healthcare. Today, every hospital prioritizes quality with accreditation and patients' satisfaction at the core of its mission. Healthcare is no longer just about individual expertise, it thrives on collective effort, structured policies, and a commitment to excellence. Every process is documented, every event is reported, and self-reporting has become an invaluable tool in driving improvement. This emphasis on accountability is not just about pointing fingers, ma'am. It is about learning, evolving, and ensuring that we uphold the highest standards of care. As nurses, we must recognize that our responsibility is not just to our patients, but to ourselves and our organization. Carelessness and negligence has no place in this profession. Every detail matters, every protocol serves a purpose, and every decision we make actually shapes the healthcare experience for our patients. I stand here today sharing my experiences because of the vision of healthcare leaders who have worked tirelessly to standardize and elevate nursing practices. It is because of their initiatives and organizations like ANEI and INS, etc., that we exist here today, and my fellow panelists are here today, and I have this platform to express my thoughts. Their contributions have not only strengthened the foundation of our profession, but have also given us the tools to deliver safer, more effective, and patient-centered care. Ma'am, I vividly remember the day I walked into the hospital as a professional rather than a student. But the reality of being in an actual clinical setting where the patient care was no longer just a case study, but a life depending on my actions was both thrilling and overwhelming. The first thing I felt was a deep sense of responsibility. As students, we are guided at every step, but in real practice, decisions carry weight. The knowledge that patients would look up to me for care and comfort gave me both a sense of pride and a sense of duty. It was no longer just about answering exam questions correctly, it was about making a real difference in someone else's life. Of course, alongside responsibility came nervousness. No amount of textbook knowledge can completely prepare us for the unpredictability of patient care. The first time I had to administer medication, monitor vitals, or comfort a patient, my hands trembled slightly. I constantly questioned myself. Was I doing this right? Did I miss anything? Would my actions actually impact the patient positively? But soon those nerves turned into confidence, thanks to the support of my seniors, mentors, and the willingness to learn. That it turned into confidence, and I started to see growth within myself. I realized that nursing is not just about clinical procedures, it is about human connection.
1 minute, 1 minute. Just a minute. You just unmute yourself. Unmute. It's got muted.
Yes, ma'am, I thought
Yeah,
the host muted
I'm so
me.
sorry. Yeah.
Yes, ma'am. So, ma'am, I was where it was about human connection, the smile of a patient, the gratitude in their eyes, and the trust that they place within us reinforced our purpose. Another important feeling which I had was awe and respect for the profession, for my colleagues, and for the patients too. The dedication of the senior nurses who managed emergencies with calmness, and even the resilience of the patients who are fighting their illnesses. All of this deepened my my admiration for healthcare. Lastly, I also experienced a shift in my perspective. Nursing was no longer just a career path. We are partners in healthcare. I understand that beyond skills and knowledge, empathy and patience are also valuable tools that a nurse can have. The small hands, like holding a patient hand, listening to their fears, and even just offering a reassuring presence were as important as any clinical intervention. And another important aspect of like nursing is keeping up with the nursing trends, which is very crucial for nursing professionals as it ensures that they stay updated on changes in patient care protocols. While I initially felt the weight of the responsibility, I soon realized that I was not alone. I am part of a well-organized healthcare ecosystem designed to support, guide, and empower me to be the best nurse that I could be. Thank you, ma'am. And I thank all the nursing leaders and every nurse who is available today and present here. Thank you, ma'am.
Thank you, Monami. Very well, you have spoken. Excellent, excellent. Your mixed feeling, and you are in a balanced ecosystem. That is the healthcare organizations today we have. And you have spoken about your mixed feeling when you initially entered and how you did the biculturalisms, the balancing between the classroom training and actual real situation where you take care of patients with your hands. And, there is no place for the carelessness and negligence in the healthcare because we are not dealing with the objects, we are dealing with lives. So that's the most important line which we have to inbuilt in our mind, that constantly you have to think the person who is lying on a bed is a human being. And if something goes wrong related to medication or anything, small bits of connecting a tubes or lines wrongly may take away the life. So that's the feeling, that's the empathy that needs to be developed with each and every staff. And here seniors play a great role, hand holding, without just not just holding in front of the patients or praise in front of everyone, but when you are correcting the person or you'd like to correct or take some steps so that the person needs some correction, you have to do it away from the patient. That's the thing which need to have by every seniors. And so thank you, Manami, for your thoughts. Very well, you have spoken. And next, I would like to share the next in this round. The question goes to Vishal. Vishal, you are with Captain Madhukari. Most welcome. So, Vishal, what do you expect from your in charge and your senior leader of the organization? What is your expectation as a nurse?
Namaste and good afternoon to all the senior nursing leaders present here. Myself, Vishal Biswas. I'm currently working at Apollo Multi-Speciality Hospital, Kolkata. I'm currently posted in the cardiac OT. So yes, ma'am, as you have directed a question, I feel, ma'am, the nursing leaders play a very important role in guiding and molding our young nurses in today's field. So I feel that the nursing leaders should not only supervise, but they should also guide the young nurses. Because as my fellow nurse Monami just told, that they have, when they're coming in the profession in a new stage, they are very overwhelmed with the feeling of joy and like fear, joy, everything is present. So when the nursing leaders properly orient them in the clinical field, giving them the proper direction, what is their job criteria, what they're supposed to do, properly introducing them to the team members, they will have a proper interaction with the group, and that feeling of fear and this separation will not be there anymore. And also how the leaders should identify, like first of all, the leaders should assess what type of knowledge the staff is possessing, or and also what is the clinical competency, and whether she is being able to use her knowledge and this clinical competency in the actual practice or not. Also, I feel, ma'am, that the nursing leaders should maintain an open door policies, like maintain an open form of communication. Like for example, if I'm having any problem, I have the freedom in my hospital in Apollo that I can reach to my seniors. If my senior is not being able to solve it, I have the freedom to, I can approach Dawn ma'am herself, who is the highest authority of nursing in Apollo. Also, I feel that recognition and non-punitive approach, this should be maintained. Recognition in a sense that when a staff nurse is, when she gets a small motivation from a senior nurse that you have done a good job, it's a job well done, we feel the sense of pride and morale boost within us. The confidence is there within us. And also, non-punitive approach is like not directly penalizing the staff for any mistake that he or she has done. One topic I would like, one point is that there's a topic called progressive disciplining, which means that basically it is an approach taken to see the performance of behavioral issues in a staff. For example, if I've done a mistake, for the first time, I will be given a verbal counseling. If I'm a repeated offender, I'm doing this for a second time, I'll be given a written counseling. For a third time, maybe a final counseling, which may be written and verbal. And for the fourth time, for a punishment, you can give a suspension without pay. But for the final time, if you're seeing it's being continually repeated and is harming the organization as a whole, then the staff may or may not be terminated. Also, nursing leaders, I feel, ma'am, they play a very important role in creating a safe space for learning. As a working nurse, ma'am, I feel that over the years, many nurses are staying in the same post over the years. They are not having any career growth, or they're in the same department overall. So I feel nursing leaders should identify the potential individuals who have the necessary skills, who can upskill themselves and go for a better post. Also, I feel, ma'am, they should motivate the staffs so that they can attend the regular CNE programs, which are online based and also which are done in the hospitals. They can attend online seminars or online courses which are available in Medversity. They can also go for this online conferences or also this virtual conference which they have. And nursing leaders, ma'am, also should see that the overall workload which a staff nurse is having is equally distributed among all the work members, all the staff members. Because usually, as Mona, I guess one of the students, I don't remember her name, sorry, she just mentioned that when a new nurse is coming into the field, she is being overburdened with all the responsibilities of the night duties, or maybe she has to check all the vitals of all the patients. So equal responsibility should be divided by the staff nurse or the staff leaders who are allocated. And finally, ma'am, I would like to say, as a nursing leader, they should see overall the mental well-being of our nursing staff, because the nurses, we are working in a very stressful environment. We are constantly seeing emergencies, deaths, stressful situations. So they should be provided with some guiding counseling, or maybe some adequate rest time after a heavy shift. So all these points, I feel, ma'am, a nursing leader should follow while while trying to manage all the staff members under her.
Excellent, excellent, Vishal. The point which you have said that, the open door policy, many times we heard that the staff suffering with some kinds of agony, but they are not able to reach to the nursing leader, nursing head of the organization. And so they don't get opportunity to get a first line of counseling, which you said, the verbal counseling and maybe a written something can be given to the person. Always rewards, recognitions, very important. Even simply a patting on the back that you have done a great job. Today you have really saved the life. You have done a good job. Or recognizing in front of all the fraternity, those who are working in the organization, in front of the employee as an employee of the month, or giving a small token of appreciation in a town hall, which really will encourage and motivate the staff. Career growth, career pathway, that is very, very important, which you have spoken today. And sending for a conference, sending for a workshop, giving this kind of opportunity, which you have got today, is also, again, a very important part of the development. And that is what our the novice, the advanced beginner, they want to take up all those opportunities, tapping the potentialities, tapping potential, put them in the right directions, put them in the right place, is very important part of the nursing leaders. Thank you, Vishal. Thank you. Now the second second round, the question goes for the Monami. Monami, how much a nurse can contribute to improve patient experience in the organization, and what is your thoughts? In almost in all corporate hospital, we have an online system of giving feedback. the patient, they get discharged, goes home, and then they fill up the feedback form, and all sort of some kinds of problem or something they have faced, they will write it down. So what is your thought? How can we improve the patient experience?
Thank you, ma'am, for allowing me to speak on a topic that lies at the heart of our profession. As nurses, we are not just caregivers, we are advocates, educators, and the bridge between patients and the healthcare system. Patient experience is not just about treatment, it is how a patient feels physically, emotionally, mentally during their journey of care. And we, as nurses, are the ones who make a lasting impact. First and foremost, compassionate communication during their whole healthcare journey is one of the strongest tools that we can use. When a patient enters a hospital, they are often anxious, vulnerable, or in pain. A nurse's gentle reassurance, active listening, and empathetic approach can ease their fears. A warm greeting, a few encouraging words, or even maintaining eye contact while explaining procedures can make a world of difference. Nurses are the voice of the patient, and we ensure that their concerns are heard, that they receive the right care at the right time, and that they fully understand their treatment plan. Patient advocacy is essential. It not only improves safety, but also builds trust between the patient and the healthcare system. Every patient is different, and so are their needs. Personalizing care, whether it is adjusting to their cultural preferences, pain tolerance, or emotional state, enhances their experience. Small gestures such as respecting their dignity, involving families in decision making, and ensuring privacy fosters a sense of comfort and trust. One of the biggest contributors to positive patient experience is safe and efficient care. As nurses, we are responsible for medication accuracy, infection prevention and control, timely interventions, and coordination within the healthcare team. A patient who feels safe and well cared for is more likely to have confidence in the system and is less likely to give complaints. Patient experience extends beyond their hospital stay, and when we educate patients about their medication, self-care, and lifestyle modifications, we empower them to take control of their health. A well-informed patient feels more confident in their recovery journey and is less likely to return with preventable complications and blame a nurse. Lastly, nurses are not just the backbone of healthcare organizations, but we are the partners in healthcare. By participating in quality improvement initiatives, suggesting workflow enhancements, and embracing technology for better care coordination, we contribute to a patient-centered culture. A hospital that values nursing excellence inevitably sees higher patient satisfaction. Thank you, ma'am.
Thank you, Manami. Thank you so much. You have touched with, nurses are not only a bedside caregiver, but advocate, educator, and every moment the emotional connect that we need to have with the patient. And so that patient will get, understand that, yes, someone is there for me to care. So that's really very important. And we are the partner of healthcare. That is the very important understanding that every nurses must have. A mistake has happened. It's not my fault. See, other person may say it's not my fault. No, it's the fault which has happened with the patient, and patient is suffering. So we are the partner of healthcare. We need to understand, instead of blaming each other, we need to take up in your mind and improve the process so that the patient safety can be created. And that is what needs to be understood by each and every.
Yes, ma'am. Thank you, ma'am.
You are muted, Madam Dolly, ma'am. You are muted.
Yeah, Manami, thank you very much. I think I was throughout muted. So I just would like to say you have spoken very well, and you have spoken about that we are the partner of healthcare. So that is very important aspect that every individual person should remember it, that we are not the only nurse, but we are responsible for patient care, and that is what we need to understand as an advocate, as an educator of the patient, as a caregiver of the patient, and then only we can improve, and we can patient will have an enriched experience from the nursing fraternity. Now questions that would like to ask to Vishal. Are you ready? So Vishal, what type of evolution or transitions you expect to happen in the clinical practice so that you can transform the nursing. So what is that you are thinking on it?
Like, ma'am, yes, ma'am, there are a lot of changes that are currently being taking place, and I feel that a lot of changes are going to come in the future. First of all, ma'am, I would like to speak on a topic, ma'am, the topic nursing autonomy, ma'am. I feel that nursing autonomy basically means that a nurse is being able to provide care by herself using her own clinical knowledge and experience. So I feel that nowadays nurses have trust in nurses have increased by over the years, but I feel that nursing autonomy will be more prevalent. Means a nurse, if a patient is coming, nurse is using her own knowledge and providing a specific treatment and care for the patient. Like nursing autonomy may be increased in the sectors of making nursing policies, or also in, as I said, patient care. Also, I feel, ma'am, that in the coming years, the standardized protocols. In the urban sectors, we are having most of the hospitals like Apollo, Fortis, and big hospitals, we are having JCI and NABH accordingly. But in the rural sectors, many other hospitals in the urban areas also are not having any standardized protocols. So I feel in the coming years, the standardized protocols for every hospital is mandatory, ma'am. Also, strict transition program, as one of the students, I guess, had told about this transition program, the preceptorship program. That is also very important because it helps in switching, helping a student nurse to transform, come into the actual working field. So like in Apollo, ma'am, you have a preceptorship training. Like when a new nurse is coming, she is having a 3 days HR induction, a 10 days 10 days nursing induction, followed by a 20 days preceptorship training, in which they are doing the hands-on training alongside a senior nurse and actually seeing what they are wanting to. So if every hospital is having this kind of preceptorship training, it will be very beneficial for the transition of nurses. Not only new nurses, any other nurses who are working in any other hospitals, be the experienced nurse also. And as we know, ma'am, technology integration is already developing over the time. Robotics, electronic health records, smart devices such as infusion pump, cardiac monitors are being widely used. But proper integration should be there, ma'am. For example, as Madhukari ma'am had given me one example, which it actually came into my mind. Like we are using BP monitors everywhere, ma'am. So when we are actually charting, we are recording it, the nurse has to every time see the timing, go and record it every time. Why not we can use AI in some way that the charting can be done automatically, so that when the nurse is also getting more time so that she can take care of her patients, and also it is reducing her workload. So this kind of technological integration should be developed in the coming years, ma'am. Also, I feel that, ma'am, the term EICU, to post-COVID, it has been started overall, means this access towards this public health in the rural areas, it has increased over the years. Many senior nurses, doctors are available in the cities, but in the rural areas, they are not available. So when they are having this electronic ICs, means they're uploading all the documents in a software and providing it to the urban centers where the doctors are giving their expert advice and sending it back to the rural areas so that the treatment can be provided. If this is incorporated more in the public health sectors, ma'am, I think the nursing fraternity can benefit a lot from this, ma'am. Also,
that's great, Vishal.
Yes,
Yeah,
ma'am.
yeah.
Also,
Please go ahead.
I feel that, ma'am, there'll be increase in the nurse-patient ratio. As you have already told, post-COVID, the people have started understanding the importance of nursing and they're coming more into the nursing field. So I feel in the coming years, the nurse-patient ratio will also improve, and the burnout level of the nurses will come down in the future years. And also, ma'am, I feel this MDTR rounds, interdisciplinary collaboration will increase. MDTR round basically means, ma'am, the nursing leaders, doctors, physicians, physiotherapists, dietitians, all are coming together and performing their rounds. But I feel, ma'am, the patient and the patient's family should also be involved in this rounds, because the patient is the best advocate for himself. He knows what is best for himself or what medication he's taking, or the family members also know. So in the future, this patient involvement in these rounds is very important, I feel. And lastly, I would like to say, ma'am, this protection for nurses against workplace violence. It is already started, ma'am. The government has provided a mandate that every organization should have a internal complaint committee. And Apollo, we are having this grievance redressal formed policies. Then POSH committee is also there. ESCA is there. So this type of policies which will uphold and strengthen our nursing field is more needed, ma'am. And I think it should be the policy should be overall generalized in all the hospitals. So these are the few changes I think evolution will come in the nursing field, ma'am, in the coming years.
Yes, very much, very true. Very true. You have touched upon almost all sorts of, transition and evolution that is required in the field of nursing. You have touched on AI. It's really now it's very, very important that everyone must understand that and how this AI is changing the entire, the paradigm shift. It's called as a complete paradigm shifts which are happening. And you have spoken on one very important thing with the interdisciplinary round. If we can involve family members, wow, that's a difference, transformation that can happen, because family members are at the receiving, families are the patient and their family member at the receiving end. They will be able to visualize us, means they are our AYNA, isn't it? We will be able to see that what they want. And so if we are involving them, we'll be able to do much more in the healthcare organization. And that's the lovely things which you have spoken today. Definitely other nursing governance, nursing policies, autonomy to the nurses, we have to take care of that. And that's what you, as a summary, I can say. And you have, of course, you have touched upon the protections of every employee of the organization from the violence. That's very important. And to some extent now, it's in the community, in our country, the eyes are open to everyone that workplace violence to be prevented, and that is what we can see. There is some upliftment which has happened after COVID. So thank you, Vishal. Thank you for your all thoughts which you have given today. And then we'll go ahead with the third round, and that will be final round. We'll finish within 10 or 15 minutes. So questions to Monami again. Monami, you can unmute your mic. Yes. So to you, what are the strategies you think that we can adopt to adjust with you adopted to adjust with the clinical field soon after transitions from students to your practical field as a staff? Actually, you have spoken, you have answered us some bit during your first questions, but what are the strategies that you have taken? If you can just highlight with everyone so that others will be able to understand. Yeah, please go ahead.
Yes, ma'am. Thank you for the question, ma'am. A journey that every nurse embarks on, transitioning from student life to clinical practice. Now, this phase is often marked by excitement, nervousness, and a challenge of applying theoretical knowledge in real-world healthcare settings. When I stepped into my role as a professional nurse, I quickly realized that the transition was not just about technical skills, but also about adaptability, resilience, and a commitment to continuous learning. While academic training equips us with knowledge, the clinical field demands real-life decision-making, emotional intelligence, and the ability to work under pressure. To navigate this transition smoothly, ma'am, I adopted several key strategies which I would like to share with you. One of the most important lessons I learned was that nursing is a lifelong learning journey. No matter how well we perform in academics, real-life patient care is dynamic and unpredictable. I made a conscious effort to observe experienced nurses, ask questions, and seek feedback. Every interaction, whether with patients, doctors, or fellow nurses, became an opportunity to learn and grow. The clinical setting moves at an incredibly fast pace. Handling multiple patients, medication schedules, and documentation simultaneously can be overwhelming. To stay efficient, I learned to prioritize tasks, then moving on to other care needs. Keeping a small notebook can also help to jot down critical information which is required during handover. As a fresh graduate, self-doubt was a constant challenge for me. However, I reminded myself that confidence is built through practice. Instead of fearing mistakes, I focused on learning from them, and seeking mentorship from seniors has also helped me gain practical insights that textbooks never cover. Gradually, I grew more confident in handling procedures, communicating with patients, and making clinical decisions. Nursing is not just a profession, it is a calling that requires immense emotional strength. I encountered patients in pain, families in distress, and high-pressure situations that tested my mental power. To cope, I practiced self-care, whether it was meditation, talking to colleagues, or simply reflecting on the positive impact of my work. A strong support system within the nursing team does also play a crucial role in helping me and several of my colleagues stay motivated. Healthcare is a collaborative effort, and an effective communication is vital. I learned to articulate my concerns, actively listen to patient needs, and work as a team with everybody. By developing these relationships, I was able to create a supportive work environment where teamwork enhanced patient care. The transition from student to professional nurse is not without challenges, but with the right strategies, it becomes a deeply rewarding journey. To all the aspiring and newly graduated nurses, since I have been in this profession for 1 year as a clinical and professional nurse, I would like you to remember that embrace every experience with an open mind, be patient with yourself, and never hesitate to seek guidance. Nursing is not just about skills, it is about compassion, dedication, and the unwavering commitment to improving lives. And our seniors are with us every step of the way. Thank you.
Thank you. Thank you so much, Monami. So be patient with self. That is most important part that we need to know. Sometime, every day will not go same. Sometime we will get a big waves, maybe sometime are small. As we dive in the sea, we take bath inside the sea, we get a big waves and a small, and that's the way how life moves. And we should understand how we can reflect back, and we think about that what we have done throughout the day, how I have behaved with my patient, how I have reacted to my in charge, what I have communicated to the patient, family and patient. So, this self-reflection is very, very important, which you have spoken. Prioritizing work, keeping a small handbook. Many people, many nurses doesn't do that. Keeping a small handbook and writing down that what I have done today, and if I get a new medication, let me write and let me go through that. What is the action? Nursing responsibility, side effects of the drug. That's very, very important, Monami, which you have spoken today. And learning from mentor and respecting mentor, respect self and respect patients, then only we'll be able to grow. And these all are actually helping to settle down and resilient with every situations. So thank you, Monami. You have really touched with all the aspects of adjusting on when we transit from the student life to a actual scenario. Now, Vishal, for you, Vishal, what message would you like to convey to the young nurses today to improve the profession and value? Because today many young nurses have joined values in our country. What is your message will go?
Yes, ma'am. There are a few points I would like to say in this message, ma'am. First of all, I would like to say, since our medical profession, nursing is within our medical profession, we should never stop learning. It is a dynamic process. It's continuously changing. What I have learned 2 years back, that has already been changed currently. Even the nursing curriculum, ma'am, you may know that this infection control subject maybe has added because it's a need of the hour. So I want to say that nursing students, even the nurses who are currently working, we should never stop learning. We should always have the strive and hunger to gain knowledge, as ma'am has already just told. If a new medication is there, we should take them, that we should constantly try to evolve ourselves and never stay stagnant in our posts. Also, I feel that we should try to uphold the nursing respect from within ourselves. First, we should try to change ourselves, like the way we groom ourselves, the way we talk, the knowledge level we possess, how one is talking to us, how we are responding to them. All these matters, all these things will judge a person's character. And when they know we are a nurse, that time they will judge the nursing profession. So first, we must respect ourselves. We must respect the profession ourselves. And all the others will respect it, seeing us. Through us, they will see how the nursing values, the ethics, the codes of ethics of nursing through us. So change within ourselves. Also, we should lift and support each other. Not like nurses will, only a nurse will understand what a nurse is going through. No other person in the whole world will ever come to know. Only a nurse can feel the other. So I feel that we should not try to fight amongst each other, or we should build a strong nursing community among ourselves. And lastly, ma'am, I would like to say that one day we will hold a patient's hand in the weekend. Our voice will be the last voice that the patient hears. Our face may be the last face that the person may see.
Absolutely.
So mainly, I would like to say that nursing is, as my friend Monami just said, that nursing is not just a job; it's a calling. Like mainly, I shouldn't say this, but I feel that my generation nurses, we are very bit relaxed. That we just feel it's like a 9 to 5 job. So really, ma'am, I feel that is, but I hope it will change in the coming years. But when we see that a person is struggling, grasping for breath, we hear a mother's cry. We see that everywhere there's need for patients are dying everywhere. That time, this patient people, they don't need someone who's just doing this 9 to 5 job. They need someone who will actually care for them, listen to them, be there in the grieving state. So lastly, I want to say that We should wear our scrubs with pride because what we do, it really matters and it always will. Thank you, ma'am.
Thank you, Vishal. You really spoke about this, the effort of continuous learning. If a nurse thinks that I know everything, I don't need to attend in service educations, I don't want to do, take part for any sort of bedside training, then the person will vanish. Because as you said, the medical science, the nursing science evolving every moment. And we need to understand that just saying that I know everything is not going to go. We need to have the mindset of continuous learning and evolving and developing, understanding ethics. And during our second round, you have also spoken about that reaching to the areas where the light did not reach yet about the modern nursing, like rural areas. Many government institutions still are not oriented with the modern gadgets, the evidence-based practices, where we need to make them take some efforts to go there, give the educations, make them to understand what is going on in the world of nursing science. So that is what is required today, and that message should go to each and every individual. Here we are almost over with the panelists with the third round, and thank you very much for all the panel members today, both the students and staff. Monami and Vishal, you did wonderful job. We did wonderful job. So I just would like to draw attention just one minute to our senior leaders. Kawaljit ma'am. Ma'am, your thought on today's panel discussion, or you would like to give any message to the entire people, those who have participated, those who have joined today, ma'am. Your feelings about today's first AYNA, the first episode of ANEI AYNA, Empowered Hours. What is your thought on it, ma'am?
Donny, first of all, I must say, let us all clap for the West Bengal chapter, and you all deserve a very, very big clap.
Everyone can unmute this video. You can enable your video so that we can take a photograph also. Yes, ma'am. Thank you. So big clap. Thank you.
Secondly, thanks to ANEI, Tankam and Ajita and all the ANEI members that they have come up with this theme of AYNA. Because when I have been hearing these young nurses, the students and the staff nurses, I was just going down my journey of for last 45 years in nursing, and I was thinking what I was as a student, what we never had anything, and what students of today are going through and expecting, and this AI and all this technology at their behest. I can see a very bright future for nursing professionals in the future. And
thank you so much.
You and all the chapter heads and their teams, I think with everyone's contribution and AYNA, a lot of ideas and innovations would be coming in, which we can always, and I'm sure Ajita has been, and Tankam, there will be, and all of us will be taking it forward and making sure that it comes into implementation and not just talk. So thank you all of you once again, Madhukari, Dodi, and all these 4 young stars. I won't name each one of you. But each one of you, you spoke so well, so well without referring to your papers. You are just speaking. It's really wonderful. It was a pleasure to my eyes to see that you people have done a wonderful job. Thank you.
Thank you. And I would like to say, ma'am, those who are instrumental, the principal, ma'am, Shampa, connected over here, Jharna, who is Florence College of Nursing principal, she has gone for a PhD, final round of getting certificate from Malaysia. She is not here. I think she did not connect it as well, but her student only, Aditi. So thank you so much to Shampa and Jharna, Vijayalakshmi Banerjee ma'am for allowing Monami, Madhukari ma'am for Vishal, allowing Vishal. So Vijayalakshmi Banerjee ma'am, would you like to speak to words? Your Monami has spoken, fabulous. She is really star, and all our 4 speakers are star today. So Banerjee ma'am, would you like to say? Vijayalakshmi Nair ma'am, I'm so sorry, I'm calling you as Banerjee. Vijayalakshmi Nair ma'am, yes.
Yeah,
yes.
That's okay. Thank you. And Monami has been joined us as a fresher just because she spoke. I'm just telling you, she's been very active, very enthusiastic, very proactive. So that is why, and she's the one who's been setting examples here. Because after I joined CMRI, even mine is also a very short stint, so she has really helped, and she has helped us in bringing a lot of change here. within the organization also. And what I keep telling them is, yes, empathy and what the patients go through. So that is one important factor she's always had. Willing to learn anytime you tell her, yes, the job is done. She's a go-getter. And she's very proactive
Thank you.
any assignment is done. I think she is setting an example here. Likewise, all the others. I'm sure the whole world has heard her today. So hopefully everybody else also, and wishing all the very best to the youngsters and of course all the nurses across the board. Thank you.
Great. Thank you so much, ma'am. Thank you so much. Shampa, would you like to say a few words as I'm seeing you? No, you are muted. Muted.
Okay. So it's really a very nice event. And Shuchishmita is also a very good student. And entire everybody, not only Shuchishmita, Aditi, Bishal, Monami, everybody spoke very well. So it was really a very nice and effective event. Congratulations to all of you. And definitely congratulations to our ANEI. Thank you.
Thank you. I'm seeing Arpita here. Arpita, would you like to say a few words with the panelists today? No, I think she's not there. Anyone? Just I can give you another 5 minutes
I'm
only.
here. I'm here. I was just
Okay,
trying to
okay,
unmute
great,
myself.
Arpita. Yeah, please, please.
It's really an eye opener to see the young people, the way they are speaking. Oh my God, it fills my heart to see that the nursing is rocking, basically.
Thank you.
I mean, they spoke the mind, when we were young and we could not speak up, but thanks to this platform and encouragement from all the nursing leaders to encourage them to speak about it in this platform. I'm really grateful to see such gatherings and wonderfully spoken. All of you,
Thank you.
it's really great.
Thank you. From Singapore, Ruma connected. Ruma, I'm glad that you have connected, Ruma. Giving you 1 minute to speak to all of us. After a long year, I'm seeing you. Thank you so much for joining. Please.
Thank you, Dolly. Thank you. Thank you, everyone here. And the student, they spoke very well. As I was the educator also in the hospital, Artemis Hospital, Gurgaon. But I'm seeing them, the talking, and they are seeing the future, how it will be. That is great. And it is well done, Dolly. And I think if they continue like this, then the nursing will be in other level.
Other level. Thank you.
Yeah,
Thank you,
will
Ruma.
cross the level. So
Great.
wish them all the best for their future. And what they have, they should continue that one, what they told today. They should, when they practice, they should practice that one from their heart, core of the heart. Then there will be the improvement. Otherwise, it will remain in the paper, because as an educator, I taught so many JCI, NABH, everything. But once it is over, everything is over. They have to continue, and they should have hungry in their belly for the knowledge. That is important. They should always have hungry in their belly for the knowledge, not the food, for the knowledge.
True.
So thank you so much.
Thank you, Ruma. Thank you. I am seeing raising hands from Shubhangi. Shubhangi, yes, over to you, Shubhangi, for 1 minute.
I think, Dolly, we are overshooting time because our IB talks has already started.
Yeah,
So
I just listened to Shubhangi and we'll close.
Yeah.
Yeah, Shubhangi, she raised her hand.
Yes, ma'am. Good afternoon, everyone. I congratulate Madam West Bengal chapter that this initiative first initiated by West Bengal chapter, and ANEI has got that vision of the need of our young nurses when the transition actually takes place. So it is a really nice session, and even I encourage my students as much as possible, my JNM students, to attend so that they can see the confidence level of the young nurses, the way they are facing and they are communicating in front of a gathering, in a professional gathering. So it is really nice. The one thing I like, madam, about that experience, ma'am, I always encourage that, as Ajita madam said, you should have a very strong foundation whenever you are going. so that whenever you become a teacher or whatever in the future now, so that clinical experience only gives you a very fantastic confidence, that I feel like, and that is the real worth or a professional, I will say it's a professional property that we have, and we carries it with us with till our last breath. So thank you very much for giving me this opportunity for speaking this my views, and thank you and congratulate ma'am.
Thank you so much. So over to Captain Madhukari just to complete the entire things. Thank you.
It goes without saying that it was a fabulous discussion, and I must thank from core of my heart Thankam ma'am, because when I first time spoke about what topic we should take, first thing she said, Madhukari, please don't take any clinical topic, because enough we discuss on clinical topics. Take something which will embrace not only ANEI but also the vision of future nursing. So
absolutely.
I really thank Ma'am Thankam for giving us this idea. And that's how the theme was thought of and brought down to all of us. And special thanks, Dolly, to you to moderate this session so well. And to all the speakers. Excellent. Each one of you, there is no comparison, but each one of you have done wonders. Nothing could be better than this. So we are proud of you. And thank you very much. Those who have joined today, for despite their all busy schedule, you have taken out time to really make it fruitful, successful. Thank you, ma'am Kamaljit, for giving us all the guidance. Thank you all so much. Thanks, Ajita, for joining us. I think it was a wonderful session. Looking forward to have much more sessions like this. And thanks, ANEI, for giving all empowerment that we are always carrying throughout. Thank you so much.
Thank you. Thank you very much, everybody. So we are leaving now. Yeah. Thank you. Thank you.
Thank you.